Well, the obvious advantage of social distancing, which is the purpose of it all really, is to help limit the spread of COVID-19 cases. Many people are also working from home, which can give them more flexibility and more time with their family and pets. But while social distancing protects our physical health, it's not so great for our mental health, especially for those living alone. Humans are social beings. We thrive on connections, and being isolated in a confined space for prolonged periods of time can cause psychological distress. As a result, people may experience anxiety, depressed mood, tiredness, decreased motivation, irritability, restlessness, and trouble with concentration. Combining work and home life in one space can also be challenging. Not to mention in a place like Hong Kong where space is so tight to begin with. So tension and friction can rise between family members, flatmates and partners.
What can people do to remain social while social distancing, especially for those who live alone, like you said?
Well, social support buffers us against stressful life events like the pandemic. So staying connected is very important. But it does take creativity during this time. Just because you're working from home, there's no reason to stop doing the things you would normally do while at work. It may just take place in a different space, in a different form. So for instance, you can message your coworkers and greet them in the morning, say hello. Schedule video or phone calls to check in with your team. Have virtual lunch breaks, coffee or tea breaks, or virtual hangout after work. You can also connect with family, friends in the same way, talking and doing things virtually, or even meet new people online by attending events or classes virtually.
As each country goes through the second wave, third wave in Hong Kong, God forbid, fourth wave, do you have 3 tips on how we should adapt to the transition of actually going back and forth between the office and working from home? Because one week you could be back in the office, and the next week when the numbers pick up, you could go from working from home again. That's quite unsettling itself.
That is very disruptive. And I think the most important tip is to be patient and kind to yourself during these times. Changes are disruptive and naturally take time to adjust to. Plans we made may fall through, and we may not be able to achieve as much as we wanted to. And that's all understandable given these circumstances we're in. There are just things that are outside of our control, so be patient and be kind to yourself. While we learn to be comfortable with our own limitations, it is also important to recognize what's within our control. And to this point, my second tip is to stick to your normal routine and maintain structure in your day as much as you can, whether working from home or working from the office, because that's something that's more within your control. And it also helps to preserve as much of a sense of normality as you can during these times. So sleep, get up at the same time you normally would, start and end work at the same time, get out of your PJs and get dressed like you normally would, and schedule in other activities outside of work. My last tip is to keep exercising or start exercising if you aren't already doing it. Exercise has short and long-term benefits for our mood, sleep, and physical health, and can be done even at our home, like doing, jumping jacks, as cardio. Exercise can release endorphins and other neurotransmitters that help reduce stress, anxiety, and improve our mood. And we can really use that now.
Are there any simple activities where we can carry out when we all of a sudden feel, a wave of panic or a moment of anxiety? Are there any simple exercises where we go, okay, this is happening, what can we do?
Yes, there are a number of simple exercises that you can do to cope with waves of panic and anxiety, like relaxation exercises, breathing techniques, like taking in deep breaths with long exhales, grounding techniques that help refocus our attention back to our senses, our 5 senses, and ground us back in the present moment. And these are just a few examples. There are plenty of resources online that can help people cope with these symptoms. But if these symptoms persist and are really affecting your overall functioning, you can also consider speaking to a mental health professional.
Well, Dr. Loong, thank you so much for your advice on how to cope through these stressful times and, at a time where we have to be kinder to ourselves and one another. Thank you.
Thank you for having me. It's a pleasure to speak here.